Welcome to Cornhole Champions, Iowa Starting Line's weekly podcast where we throw bags at the state's biggest stories. I'm Zachary Oren Smith. Iowa has the second highest rate of cancer in the nation, and we're one of the only states where cancer rates are actually increasing. As part of our series investigating cancer in Iowa, we've been turning over this question of why Iowa's cancer rates are so high. Previously on the show, you've heard from cancer experts on what you can do to reduce your chances of getting cancer. But to some extent, the environment is outside your control. Today, I have on a medical doctor, another one, to talk about what smart regulation could do to help with this issue. My guest is State Representative Austin Baeth, who brings a unique perspective to the State House. He's both a practicing physician and a policymaker. As someone who treats cancer patients and writes laws, he's seen firsthand how policy decisions affect public health. We're going to talk about the regulatory tools Iowa could use to bring down cancer rates and what's standing in their way. Hello, Austin.
Thanks for having me, Zachary.
Thanks for joining me for a little bit. Austin, I'm glad you're here because I've been wanting to speak to someone a little bit about kind of what our regulatory environment looks like currently and what could be possible through it. But before we get there, tell me, when I run into you out in the wild, it seems like you're always in front of a new group of folks, talking to them about this exact story, right? Trying to explain to them kind of our high rates, maybe pointing to some of the contributors, but I mean, ultimately, like I think trying to impress on folks the gravity of this of Iowa's cancer problem. When did Iowa's cancer rates become such a focal point for you?
I think for the last several years, my colleagues and I were noticing that we were encountering patients who seemed to be younger, without obvious risk factors, who were coming down with cancer. And I think even before the news broke that we had the second highest cancer rate in the country, we already had a suspicion that something was going on in our state. And so it's now been 3 years in a row that Iowa has had the second highest cancer rate in the nation and the fastest rising cancer rate overall. And it was that year that the news first broke that I was serving in my first term in the legislature. And for me, this hits close to home. Every day in my primary care clinic, I'm encountering folks who are either dealing with cancer personally or taking care of a loved one with cancer. I also work in palliative care, where I take care of folks in the hospital who are dying of this disease. You don't have to look far to find somebody who's been affected by cancer, either personally or somebody they know or love. And
Right.
so the opportunity is ripe for politicians of every stripe to come together and find public policy solutions to fight this. And I find myself kind of in the right place to try to galvanize that effort.
I was covering the Iowa legislative session this past spring when, during the governor's State of the State address, this issue actually got a whole section devoted to it, which was, I think, for those of us who are thinking a lot about Iowa's cancer rates, was felt like a victory. And the way she spoke to, there were some behavioral issues, things like our, higher than average rate of binge drinking, and also like the promise of $1 million in additional research funding. I wanted to see if you kind of start us out by kind of explaining the state of play, so to speak, in the state. You've been kind of looking at this from a really high vantage point. What is the state of play for cancer? Kind of work to reverse Iowa's cancer trends?
Unfortunately, our state is just getting started to work on this. This is something that I've been bringing up for the last 2.5 years to try to get some policy action on this. And I am thankful that the governor and our legislature have now committed $1 million into cancer epidemiology. So I think that that's step one. Cancer epidemiology means that we need to study the root causes of our cancer crisis. We can't fix the problem unless we know exactly what's causing that problem. And so $1 million, isn't a lot of money when you look at our $10 billion state.
I think the auditor called it a mouse fart.
I believe he did characterize it as a mouse fart. I would call it more than a mouse fart. I don't know what animal you want to choose, because cancer epidemiology fortunately is of medical research, one of the cheaper forms. We can actually get a lot of good information from the research that's funded by this. Obviously, more would be better, but this is the start that we need to start to identify where we need to be honing our legislative tools to bring these cancer rates down.
And so getting information, right? Getting a sense of what's, kind of what might be the drivers, is an important conversation. But like to some extent, I mean, what do we spin out for me, like what we expect to find, right? I mean, because like it feels sometimes when I've been working on this investigation, like to some extent, like it kind of feels like we know what are some places to begin, right? Like, and I'm curious about like kind of what I don't know, spin that out for me a little bit about why that research piece is so important here.
Yeah, yeah. I think a lot of people have their guesses, and I'll kind of run through a few things that we consider, things that maybe are higher on the list than others as our main culprits. Um, let's first back up and look at who's number one in cancer, and that's Kentucky has the highest cancer rates in the nation. Why? Because folks in Kentucky smoke at very high rates. Well, in Iowa, we have about an average smoking rate, so we can't blame smoking as the cause of our extremely elevated rates. Obesity, we're about 13th in the nation in obesity. So, while that is causing some of our cancer problem, we can't say that that is the main driver. Radon, radon probably is a factor here. We have one of the highest radon levels in the country. Every single county in Iowa has a level 1 radon level, the highest level. And that I view is actually, politically speaking, probably low hanging fruit for us to tackle with state policy because it is not yet partisan to do so. When we start to get into the partisan things, is where I think we probably still have culprits high up on the list that are going to be tough to tackle. And I know that you've talked about it on your podcast, and certainly near and dear to my heart is what's going on environmentally in our water, in our air, that might be contributing. Because, Kentucky's got smoking. What the heck over here in the center of the Midwest do we stand out with compared to other states in this nation? And that's what's in our water. That is chemicals, it's nitrates. And I don't want to speak out of turn till we have more data to really back up that that might be a main driver of our cancer crisis. But we need to at least put forth some honest research to get that answer.
Yeah. One of the kinds of cancer driving our kind of like aggregate rate in a large way is lung cancer. And unlike Kentucky, we've got really high rates of radon in our living in our residential spaces, and kind of for folks that maybe haven't been paying attention to the series or haven't been paying attention to this is one of the second greatest drivers of lung cancer within cancer patients is connected to radon exposure. Radon is a kind of a colorless. It's a gas you may not realize you're being exposed to, but for folks in the Midwest, right, it's this. It is a substance that's very much present in our environments. And there's been some like talk about like the extent to which there is a regulatory solution to it. One I've seen has been for if you're a homeowner, right, getting a radon read of the basement is like a pretty normal part of a home inspection. But if you're a renter for an apartment, right, this may not be a piece of information that you know about going into the process. There I could see a world where a city says, if you're going to have a rental permit, we're going to require you to get it to either get a radon reading and have that present in the lease. And if it's at a certain level, I mean, I could see a world where if you're gonna rent the space, and you need to get it mitigated if it's at a certain level of intensity. What puts the brakes on an idea like that going into effect?
With every public policy, there's winners and losers. And in this case, the losers of a policy like that would be landlords. Landlords are organized. the Iowa Landlord Association. They typically pair up with the Iowa Realtor Association. And so, immediately you're butting up against special interests. And, those associations write campaign checks,
Totally.
and uh, singular renters don't have an organized group that would lobby for the other side of this. So that big picture is the main roadblock for enacting common sense solutions that would help out the 40% of Iowans who rent their home. Now, I am proud to say that I helped write a bill that got past the Iowa House that that enacted rental tenant protections against radon. And in this particular bill, the onus was on the tenant to do the checking, to check their unit for radon. And if it was elevated, they told the landlord. The landlord had a certain amount of time to mitigate that radon. And if they failed to do so, the tenant was able to leave their unit without any sort of financial penalty of an early termination of their lease. Now, that
Wow.
was like we were asking for a very small capitulation from the landlords to allow something like that. Like the biggest risk to a landlord would be, you lose a tenant.
Yeah.
But we would hope that would be enough to make them learn, this is going to happen again and again if we don't fix our rental unit. So,
Now, did this create like a just cause for breaking a lease? Is that how that worked?
right. So this would basically, correct. So this would create just cause for breaking the lease, and therefore they could break that lease early without any sort of early termination fee. So that I think has legs. I think that might actually get through eventually if we can get the Senate to take up any of our bills. But that's what we have to kind of feel out here are what are at least those small steps where we can start to move the needle. And then hopefully the next year we'll take a bigger step.
Yeah. Tell me, you've been working on a couple of different approaches for this. What are some other ideas floating around the space that, if as you know, if you're a person in Iowa who doesn't spend their entire spring, doing shoe leather at the state capitol, maybe there's a piece of this that they want to like to write to their representative, write to their senator about. What give me some ideas that might be of interest to people listening at home.
Yeah. Continuing on with radon, because again, I think this really is the low hanging fruit right now that we can make some
Yeah.
progress on. A bill that for the second year in a row we got through the Iowa House would be for new homes being built to mandate that home builders build in passive radon mitigation. And as you might guess, the special interest group that was a little unsure about allowing that bill to go through was the Iowa Builders Association. But they
Right.
have said that most of their builders do that anyway. And so we actually got that through the Iowa House twice. And again, was kind of found a dead end in the Senate. But I'm hopeful that that'll be picked up hopefully this next session. I'm proud to say that we got a whopping $20,000 allocated. Again, $20,000 in our $10 billion state budget, $20,000 allocated for free radon testing for any Iowan who requests it. That started in July and this last July, and in 2 months, all of those tests, that's 1,200 tests, were taken up. That's a really strong sign that Iowans are aware of this problem and the demand is there. So my hope is that was a step in the right direction, moving the needle, and that's going to hopefully galvanize my colleagues in the legislature to allocate even more money so that there is not that financial barrier to even finding out if your home has elevated radon levels or not. 70% of Iowa homes have an elevated radon level. 70%. So, but you're not alone if you haven't checked yours. Maybe only 1 in 15 have had their homes checked in the last decade. We talked about all these various drivers, and I kind of said, smoking is probably not the main reason why we have our excess rates of cancer in Iowa, but because smoking causes such a large proportion of cancer for every state, we could do more to bring down our smoking rate in Iowa,
Certainly.
and that would have a huge effect on reducing our cancer rates. Two important things we could do to bring down our smoking rate. Probably the most effective would be to increase the tax on cigarettes. That is one of the most evidence-based interventions you can do, mostly because young people are the most price sensitive. And if you increase a pack of cigarettes by $1, they're going to think twice or three times before they go and pick up that habit. The other
Yeah.
thing that we should really be doing is e-cigs, vaping is not taxed at all. Not taxed at all. We're one of the few states left in the country that doesn't tax e-cigarettes. And most of our kids are vaping. That is the gateway into cigarette smoking. And so that's another thing that we really need to take a good hard look at. And we even had some Republican senators who proposed that last year.
No, that's news to me. For whatever reason, I thought e-cigarettes were taxed at the same rate that like a smokeless tobacco
That
would
would
be.
make sense, wouldn't it? But no, it is not right now. We happen to have had some legislators in power leadership who are a big fan of the vape.
Right.
So that legislation did not go very far.
They blew fat clouds into your face and mine, I guess. When like I don't know, like I think to some extent this is like the biggest downer conversation, right? Because what we're saying is like when we allow Iowans to act as they are at the status quo, we are having over application of things like nitrogen in our fields, and we're having overuse of things like tobacco, right, in our lives. We're talking about creating systems of incentives, of disincentives for creating behaviors that help drive our better outcomes for Iowans, for our health. How do you make that case to folks? Like I think like you and I at the beginning, you and I were talking about like the that you don't have to explain the stakes of cancer. Everyone knows someone who is impacted by cancer. But how do you make the case to them that not only do we need to get more serious about doing something about our high cancer rates, but we need to take action. There needs to be action in order to make a meaningful impact on our cancer rates.
Right, right. I think we have quite an opportunity to make some pretty large strides in this. And that's because it could be coming for any one of us, cancer. This is something that has a real enemy that has invaded our borders, and anybody can fall victim to it at any time. When we turn on our tap, is it going to be me next? More, even worse, is it going to be my kid next? I think that when issues affect somebody personally, that's when you get the most action out of them, and that's when you get people to speak up. God
Mm.
forbid it happens to, more of our fellow citizens or the people that they love, but there's something they can do about it. And I'll tell
Right.
you that it was now, gosh, a year ago, or was it two? I had a man come up to me at the Capitol. He drove in from two counties away. And earlier that week, his wife died of brain cancer.
Wow.
And he said, I want to know what you guys can do about it. That was his way of, I think, turning his grief into a positive.
Hmm.
But we need more people like him to talk to their lawmakers and tell them, hey, all of our collective lives are on the line here. And not only that, if we talk about economic development and making this a welcoming place to stay or to move to here, we don't want to be a place where you're at increased risk of getting cancer. That's no way to
Right.
attract a young, vibrant workforce. So there's so many reasons, medical and otherwise, that we Iowans can be urging our lawmakers to do something about it. And I think that one of the most important things that we all can do this time next year when we're reelecting or electing for the first time state representatives and state senators, the first thing we should be asking them about is what are you going to do about our cancer crisis? That needs to be issue number one right now, because I don't know of something else that is more salient to our quality of life or even length of life in this state.
Mm. Austin, before I let you go, is there anything you'd like to plug while I have you here?
I think a way for folks to make sure that they're kind of um, abreast of what's going on in the legislature and ways that they can advocate. The Iowa Cancer Consortium is a great resource of what is going on in the state of cancer in Iowa and what sort of issues are being discussed in the legislature. Also, the Iowa Cancer Action Network is another great organization where you can sign up and receive um, policy alerts for you to contact your lawmakers about particular policies and tell them to get it passed.
That was Austin Baeth, a state representative and physician here in the state of Iowa. Austin, thanks for joining me.
Hey, thanks for covering this really important issue, and we'll get it turned around.
That was another episode of Cornhole Champions. If you have questions, please send them in to Zach at iowastartingline.com and be sure to include where in the state you're writing from. We're an audio medium, so send in a voice memo if you're brave. Keep questions to under 90 seconds. We'd love to hear from you. While you can watch Cornhole Champions wherever you listen to podcasts, the best place to subscribe is our YouTube. That's youtube.com/iowastartingline. Like and subscribe to help us grow this platform. The best place you can follow my work and every twist and turn of the show is my Substack newsletter. Give me a follow over at cornholechampions.substack.com. We are on Instagram and TikTok with clips of this show and with videos of us thinking through the stories we're covering. Give us a follow. If you like the show, I think you'll like what you find there. Last, Iowa Starting Line's flagship newsletter is a tremendous resource. Subscribe to it at iowastartingline.com/newsletter. You won't be sorry. Cornhole Champions is a weekly podcast powered by Iowa Starting Line. This podcast is produced by me and edited by Rebecca Steinberg. Our music is by Avery Mossman, and our show art is from Desiree Tapia. Cornhole Champions is a proud member of the Iowa Writers Collaborative. We'll see you with a new episode next Wednesday. Until then, I'm Zachary Oren Smith. Thanks for listening.